Hello, this is Utopia Simpson. I will be doing an integrative therapy video signature assignment. I'm going to start with the initial psychiatric evaluation format. Identifying data. Ricky is a 21-year-old black male who lost his job as an assistant manager of a local grocery store. He is unmarried and lives at home with his mother. He spends most of his time playing video games on his day off. He was seen by his primary care provider and sent to clinic for evaluation of his anxiety. He reports that since uh, being promoted to assistant manager, he has become more anxious just going into work. He would become physically ill when he had to speak with his crew or give instructions. His anxiety had become so bad he was calling in from work frequently and was unable to carry out his managerial duties. Chief complaint. I am here to seek help for my anxiety. I would like to be able to find and keep another job. I would like to interact with my coworkers and friends without fear of embarrassment. Reiki fill out the three-question mini social phobia inventory. And on a scale of 1 to 4, with 4 being extremely anxious, he scored a 4. This is according to the DSM-5 tiara. Which of the problem have bothered you that caused you to lose your job? Fear of embarrassment has stopped me from effectively communicating with my coworkers. I avoid work functions and meetings where I must interact with my coworker and boss. Fear of looking stupid or sounding stupid stops me from speaking up even when expected to. We're going to use the Lebowski Social Anxiety Scale, which measures how social anxiety disorder plays a role in one's life across a variety of situations. History of present illness, anxiety, review of systems, all system review, and negative. Past psychiatric history, none. Family history, father deceased, mother with history of depression, takes an SSRI. One sister who is married with two children, no psychiatric history. Social history, he lives in Marietta, Georgia with his mother. He denies tobacco, alcohol, and illicit drug use. Medical history denies. Surgical history denied. Psychiatric history none. He has no known diagnosed allergy. Labs are unremarkable. Mental status, he is alert and oriented times 3. Psychiatric diagnosis, social anxiety disorder. Differential psychiatric diagnosis, panic disorder, avoidant personality disorder, agoraphobia, body dysmorphic disorder, schizopersonality disorder, and generalized anxiety disorder. Kaplan and Sadak, 2014, define social anxiety disorder, also known as social phobia, as a disorder that is characterized by extreme fear and anxiety in a social situation. A person is extremely worried about self embarrassment, which leaves them incapacitated. Treatment plan. I recommend starting psychotherapy for Ricky, and he agrees to attend therapy. Ricky returned to clinic today to start his first therapy session. The three therapies I have chosen to use in helping Ricky are cognitive behavior therapy, CBT, interpersonal psychotherapy, ITP, and acceptance commitment therapy, ACT. These three therapies can be used individually and combined to help Ricky identify and develop insight into causes of anxiety and help find solution in behavior changes to help him in his daily life. Definition of keywords according to Merriam-Webster Dictionary. Cognitive, related to being or involving conscious intellectual activities such as thinking, reasoning, or remembering. Behavior, the way in which someone conducts oneself or behaves. Therapy, treatment intended to relieve or heal a disorder. Treatment of mental condition by verbal communication and interaction. Interpersonal psychotherapy that focuses on a patient's interpersonal relationship. Psychotherapy, treatment of mental or emotional disorder or of related bodily ills by psychological means. Acceptance, the quality or state of being accepted or acceptable. Commitment and agreement or pledge to do something in the future. I'm going to define each psychotherapeutic approach and show why it is appropriate to Reiki's case. Cognitive behavior therapy, CBT, according to Wheeler 2014, is the most widely researched psychotherapy model that shows its effectiveness in the treatment of a wide range of emotional and behavioral problems. It is the most popular treatment of choice for most patients who need internal resources and coping skills enhanced. The therapist and the patient set measurable and realistic goals that help them see progress. The cognitive model, situation and event, automatic thoughts, the actual words or images that go through a person's mind. The thoughts are instantaneous, habitual, and non-conscious. Reaction, emotional, behavioral, or psychological. Core belief, our most deeply held assumption about ourselves, the world, and others. They are firmly embedded in our thinking and significantly shape our reality and behaviors. Intermediate belief, attitudes, or rules that a person follows in his or her life that typically apply across all situations. 2. Interpersonal psychotherapy. Wheeler 2014 states ITP is based on the operating principle that psychiatric disorder occur within an interpersonal social contact. How a person interacts with others based on early childhood experiences and current social reinforcement. The goal of ITP is to reduce or eliminate the psychiatric symptoms by improving the quality of the patient's current interpersonal relations to social functioning. Acceptance commitment therapy encourages people to embrace their thoughts and feelings. According to the Association of Contextual Behavioral Science, ACT is a psychological intervention that uses mindfulness and acceptance strategies to increase flexibility of the mind. It allows a person with social anxiety to develop commitment together with psychological flexibility and mindfulness to gain acceptance of their thoughts and feelings. It uses 6 core processes, which are acceptance, cognitive diffusion, being present, self as contact, values, and commitment action. I'm going to discuss all 3 modalities that I have chosen and why I will use all 3 in Reiki case instead of using just 1 or 2. The 3 modalities chosen have been researched and shown to be effective in the treatment of social anxiety disorder. According to a published research article by Stringer et al. 2011, CBT and interpersonal psychotherapy are both supported psychotherapy that is commonly used to treat social anxiety disorder. Both teach different ways of thinking, behaving, and reacting to different situations. Both teach patients how to feel less anxious, fearful, and how to learn and navigate social skills. Acceptance commitment therapy is a form of cognitive behavioral therapy that practices mindfulness and goal setting to reduce anxiety and social discomfort. We're going to discuss the order in which these therapies are going to be used in Reiki's situation. I'm going to first start with cognitive behavior therapy because it's most widely used and studied psychotherapy in the treatment of social anxiety. Second modality will be interpersonal psychotherapy because it focuses on the importance of the interpersonal environment and relationships as the foundation of personality development. This also forms the basis of psychiatric disorder. The third modality, acceptance commitment therapy, A form of cognitive behavior therapy encourages people to embrace their thoughts and feelings rather than fighting or feeling guilty about them. It has found to be effective in the treatment of social anxiety disorder. I'm going to provide discussion of the expected overall encounter with the sample. The overall expected encounter is to develop a therapeutic and trusting relationship with my patient. The encounter is to help Reiki actively participate in the therapy session, thereby building collaboration and teamwork. The CBT activity session will be interactive with questions and answers. ACT section will discuss strategies to decrease anxiety and fear. An ITP session will be built on discussion of relationship. I'm going to provide an example of how these theories can be used to support cultural diversity in my patient. According to Graham et al., 2014, CBT therapy is effective across multicultural and all socioeconomic status. It is used with population across the lifespan. ACT and ITP also support cultural diversity. I'm going to provide a discussion of the expected overall encounters with the sample patient, including potential barriers and issues that might anticipate when working with my client. Fear, discrimination, and stigma are a few of the reasons African American and other minorities are reluctant to seek mental health care. According to Williamson 2012, research shows that the rate of mental health disorder ranging from mild to moderate are similar across the race and ethnicity. However, white adults are nearly twice as likely to have received mental health services as compared to blacks and Latinos. When they do receive care, they are treated differently than their white peers. They are less likely to be offered medication or behavioral therapy. Concerns about how they might be treated by a therapist, a psychiatrist, or a counselor if that person comes from a different race, ethnicity, or culture may prevent a person from seeking mental health care. The fear of being judged by someone who does not understand their lifestyle or situation is another barrier to seeking mental health care for African American and Latinos. In this case, therapists must be cognizant of the role cultural differences play in treatment modalities. I'm going to provide a conclusion of the three complementary integrative therapies. In conclusion, the three complementary integrated therapy chosen will help Reiki overcome its anxiety in the social setting. They will help eliminate his anxiety by replacing negative thoughts with positive thoughts. Therapy will allow him to feel more comfortable in a group social setting and allow him to carry out his social and professional duties. I'm going to explain what I'm going to do in the three therapies I have chosen. The first therapy is CBT therapy using Beck cognitive model. I'm going to set goals for session 1, 2, and 3. Mindfulness relaxation exercises. I'm going to set homework that facilitate cognitive behavior change, and I'm going to elicit feedback. Session 2, the interpersonal psychotherapy. I'm going to address past interpersonal difficulties in understanding current problems. I'm going to provide a summary after each section. I'm going to set homeworks, and I'm going to elicit feedback. The third session, the acceptance commitment therapy, we're going to discuss psychological process of mindfulness and flexibility in our thought process. That acceptance rather than control is what leads to committed change. We're going to start with Reiki's appointment. First therapy is the cognitive behavior therapy. This appointment was scheduled after the first clinic visit. Reiki has agreed to start therapy. I will demonstrate the use of cognitive behavior therapy, which is the first chosen therapy. I will be using Beck's cognitive model. Consent. Ricky, do you understand and give consent for this section to be videotaped and submitted to the UMass Global University?
Yes,
Good afternoon, Ricky. How are you doing today?
not so good.
Not so great?
The last time, wait, I'm sorry. Can we start it back?
Okay, go ahead.
No.
What brings you to the office today?
The last time I was here, I agreed to start therapy today to help me with my social anxiety.
I am glad you came in today to start therapy. The goal for therapy is to find the best way I can help you deal with your anxiety.
Okay.
We're going to use the CBT model, situation and events. Where do you mostly feel anxious?
I have anxiety about attending social events, meetings at work, or eating in social or public restaurants.
Automatic thought. What symptoms do you have?
Excessive fear and feeling of doom about embarrassing or humiliating myself by saying or doing something stupid.
Therapy, reaction, emotional behavior, or psychological. How do you react or behave around new people?
I avoid eye contact or talking with people. I feel my heart beating very fast. I get very anxious. My palms get sweaty. I get nauseated. And sometimes I throw up.
Core belief. Why do you think this happens?
I guess I worry all the time about embarrassing and humiliating myself in front of others. I do not want to be the butt of social jokes.
Okay, Ricky. Today we are going to work on relaxation and mindfulness. Relaxation and mindfulness to increase awareness of thoughts, feelings, and uncontrolled breathing for anxiety. I'd like you to sit back and close your eyes. I would like you to start thinking about your life and your future. You can think out loud or to yourself. Think about losing your job and how sad you are right now. How are you feeling?
Sad.
On a scale of 1 to 10, how do you feel?
About a 7.
Keep your eyes closed and focus on your breathing or the sensation of your breathing. You can notice the air going in and out of your lung as you breathe, or only the sensation of breathing. Whenever your mind wanders, gently come back to focusing on your breathing. Do not be critical when your mind wanders or when thoughts pop in your mind. Just simply acknowledge they are there and gently bringing your mind to focus on your breathing. You can do this at home whenever you feel your mind is stuck in an unhelpful thought process. You can start at 5 minutes and work your way up in time as many times as you can. Second, therapy, interpersonal psychotherapy. Ricky has returned to the clinic for his second session. In this therapy session, I will demonstrate the use of the second chosen modality, which is interpersonal psychotherapy. Ricky, do you understand and give consent for these sessions to be videotaped and submitted to the UMass Global University?
Yes, I do.
Today we are going to discuss how your thoughts and behavior influences your interaction with other people. What happens when you meet new people or must start a conversation with people?
I do not meet new people because of fear of embarrassment or making a fool of myself by saying something stupid. Making conversation with coworkers leaves me nervous, shaking and stuttering so bad that I am left alone most of the time.
I would like you to pick one person in your office and start a conversation. Let me know how it went at our next session.
Okay.
Final session, we're going to be using the acceptance and behavior therapy. Ricky has returned to the clinic for his final session. In this therapy appointment with Ricky, I will demonstrate the use of the third chosen modality, which is acceptance and behavior therapy. Ricky, do you understand and give consent for these sessions to be videotaped and be submitted to UMass Global University?
Yes, I do.
How are you doing today?
I'm doing fine. Feeling a little better today.
How was your week?
It was not bad. I was able to start a conversation with one of my coworkers. I was nervous, but it went well. I'm planning to speak with him again tomorrow.
In this session, we are going to discuss the fourth process of ACT, which is contact with present moment. The goal is for you to be attentive and responsive to what is going on in your current situation. When you feel anxious, bring your focus back to the present moment. Be aware of your emotions and how your body responds to stresses around you. Refocus your mind to the present. Accept your thoughts and feelings without judgment. Termination and last session, and relapse planning to help Ricky understand how he can use these tools to help himself in other situations during and after therapy. I'm glad you are feeling a little better. There will be times when you will be anxious, but I want you to remember all the exercises we have done in all three sessions and use them to help alleviate your anxiety. Keep a log of your symptoms and the different exercises you use to help lessen your anxiety at the time. Bring the log with you at our next clinic visit. I am here for you and is always available to talk. Thank you for coming today.